Wow, a very fresh mixture of different fruit extracts will keep your blood moving. Do you know that fallopian tube blockage has become one of the problems that affect most marriages today? Most women cannot conceive because of fallopian tube blockage. And the worst part of it is that majority of these women do not know that their fallopian tube is either damaged or blocked. This is because there is no noticeable symptom of fallopian tube blockage, probably until they begin to experience difficulties in getting pregnant. Then they will go for scan and notice that their fallopian tube is either blocked or damaged. This is why it is medically advisable for every expectant mother to always go for a routine check to ensure the status of your fallopian tube and other reproductive organs before conception. Today, in this video, I am going to discuss the causes of fallopian tube blockage, the symptoms, and the treatment for fallopian tube blockage, as well as predisposing factors that can facilitate the blockage of fallopian tube. Alright, so welcome back. If you're just joining us, this is Ife Health View, where we talk about everything reproductive health. If you're a new subscriber, thank you for subscribing. If you're not a subscriber, thank you for coming back. Today, in this video, like I said before, I am going to discuss the causes of fallopian tube blockage and the symptoms, as well as the treatment for fallopian tube blockage. We will also know the predisposing factors that could expose anyone to the blockage of fallopian tube. The female reproductive structure which connects the ovaries and the uterus is known as the fallopian tube. The fallopian tube, which is also called the oviduct, is very essential for conception to occur. Without the fallopian tube, it may be very difficult for conception or pregnancy to occur. This is because fertilization actually occurs at the ampulla region of the fallopian tube. This is why this tube is very, very important when it comes to conception. Therefore, the healthiness of your fallopian tube impacts your fertility. So, when the fallopian tube is damaged or blocked, it becomes almost difficult for pregnancy to occur. About 35% of the cases of infertility today is due to fallopian tube blockage. What are the symptoms of fallopian tube blockage? Blocked fallopian tube don't even have noticeable symptoms. A lot of women do not even know that they have fallopian tube blockage or their fallopian tube is either damaged or blocked. Probably not until they begin to experience difficulties in getting pregnant and they go for scan and eventually discover that they have fallopian tube blockage. Although in some cases, when the fallopian tube is blocked or damaged, the person may experience mild and regular pain at one side of the abdominal region. This usually occurs in the type of fallopian tube blockage called hydrosalpinx. Hydrosalpinx occurs when fluid fills the blocked fallopian tube. In addition, conditions that can lead to fallopian tube blockage can also cause their own symptoms. For instance, endometriosis sometimes causes very painful and heavy period with pelvic pain. Endometriosis can also increase your risk for blocked fallopian tube. What are the causes of blocked fallopian tube? Fallopian tubes are usually blocked by scar tissues or pelvic adhesions, and these can be caused by many factors, which includes the following. Pelvic inflammatory disease is one of the factors that can cause fallopian tube blockage. This disease can cause scarring or hydrosalpinx. Like I said before, hydrosalpinx occurs when fluid fills or enlarges the blocked fallopian tube, and this is a common disease that could lead to fallopian tube blockage. The second factor that can cause scar tissues or pelvic adhesion leading to fallopian tube blockage is endometriosis. Endometrial tissues can build up in the fallopian tube and cause blockage. Endometrial tissues on the outside of other organs can also cause adhesions that will block the fallopian tube. The third factor that can cause fallopian tube blockage is fibroid. These growths can block the fallopian tube, particularly when they are attached to the uterus. Fibroids are abnormal growths that are attached in or on the uterus of a woman, and these growths can block the fallopian tube, particularly when they are attached to the uterus. Sometimes these tumors become quite large and cause heavy period and severe abdominal pain. In other words, they cause no signs or symptoms at all, and they are typically non-cancerous. The cause of fibroid is unknown yet. Most times, most women do not even know that they have fibroid, probably until they begin to experience some severe pains towards their abdominal region and go for a scan before they discover that they have fibroid. Anyways, in my next video, I am going to discuss on the predisposing factors that can cause fibroid, symptoms and treatment for fibroid. Watch out for that video. But today, note that fibroid is one of the factors that can cause fallopian tube blockage. The next factor that can cause fallopian tube blockage is certain STDs, that's sexually transmitted infections. STDs can cause fallopian tube blockage. This is the number 4th factor that can cause fallopian tube blockage. And these STDs include chlamydia and gonorrhea. Chlamydia and gonorrhea can cause scarring and lead to pelvic inflammatory disease, which will result into the blockage of fallopian tube. Past ectopic pregnancy is another factor that can cause blockage of fallopian tube. I am going to do a video explaining more on past ectopic pregnancy, so watch out for that video. But note that it's one of the factors that can cause fallopian tube blockage. The 6th factor that can cause fallopian tube blockage is past abdominal surgery. Past abdominal surgery, especially on the fallopian tube themselves, can lead to adhesion, pelvic adhesion, which will block the tube. Alright, let's talk about the treatment for fallopian tube blockage. If your fallopian tubes are blocked by small amounts of scar tissues or adhesions, then your doctor can use laparoscopic surgery to remove the blockage and open the tubes. But if your fallopian tubes are blocked by large amounts of scar tissues and adhesions, then the treatment to remove the blockage may not be possible. Although surgeries to repair tubes that are damaged by ectopic pregnancy or infections can be an option. But if a blockage is caused because part of a fallopian tube is damaged, then a surgery can remove the damaged parts and connect the two healthy parts. Let's talk about the possibilities of getting pregnant with a damaged or blocked fallopian tubes. It is very possible to get pregnant with blocked fallopian tube, but following the treatment for fallopian tube blockage. Although your chances of getting pregnant is dependent on the type of fallopian tube blockage you have and the severity of the blockage. A successful pregnancy is more likely to occur when the blockage is near the uterus. Although success rate is lower if the blockage is at the end of the fallopian tube near the ovaries. But the chances of getting pregnant with tubes damaged by ectopic pregnancy or infection is very, very small. This is dependent on how much of the tube is removed during surgery and what parts is removed. Therefore, it is medically advisable to discuss with your doctor before treatment to know your chances of getting successful pregnancy.